Okay, we're going to begin our press briefing. Good afternoon. I'm Peter Zanoni, Corpus Christi City Manager, and today we're conducting our joint City Nueces County briefing on COVID-19. I'll be providing you an update on our statistics since yesterday, Sunday, and since our last briefing, which was last Friday. I'm going to talk to you a little bit about how we did over the weekend in terms of our closed beaches and our closed parks in light of the holiday and our goal to minimize groupings. And then we'll give you an update on the small business recovery, how that's coming along. The City Council approved an agreement last week with the LIFT Fund, and I just want to let you know how things are moving there. And then we're going to talk to you about an update on the Corpus Christi the University of Texas A&M at Corpus Christi, their project that they are helping us on. I want to provide an update on that work. And then Annette Rodriguez, Director of Public Health, will provide some information on COVID-19 and in particular highlight the drive-through testing that took place today and then talk to you about the next drive-through event that'll take place. I did want to point out before I get into the statistics that we know it's important for the community to hear from our medical professionals and scientists. And to that end, this week, we'll have our local health authority, Dr. Ramachandruni, come in and speak to the community in one of these press meetings. We're not sure exactly when it will be, but it'll be anywhere from Tuesday, Wednesday, or Thursday. And he's our contracted local health authority. He's a doctor, and he is one of very few in this region that specializes in infectious disease, which is what COVID-19 is. So he'll be a great person to tune in. We should know by tomorrow, and we'll let the public know and the media know, because he's a real asset for us, a good part of our team. He's new to the team. We brought him on earlier this year, just before the COVID hit us, but very smart man and very schooled in his science. Over 10 years, he specialized in practice in the infectious disease area. So we'll bring him in for the public to get some information directly from him this week. Okay, so let's begin with the number of cases. So since yesterday at 4 o'clock, we update the case log every day at 4 o'clock for a 24-hour period. And since yesterday, we're reporting 3 additional positive cases. So for the county of Nueces, we have a total of 79 positive confirmed cases. So initially, yesterday, it was 76, and it goes up now to 79 with the 3 new cases. Those 3 new cases, 2 of the 3 are within Port Aransas, and then the third is a resident of Corpus Christi. So 2 Port Aransas persons, 1 Corpus Christian of the 3 new cases, a total of 76. We still have 0 deaths in Nueces County, which is good, and our medical professionals are working hard to keep our persons safe and healthy, and so we're still pleased and happy to report no deaths as a result of COVID-19 in Nueces County. The 3 new persons, 1 was male and 2 were female, and so our distribution is still about 50-50. 52% of all our cases are male, and then 48% are female. And then the age distribution, we have 9 age brackets that we look at from the ages of 0 to 19, and then 10-year increments all the way up to a 90+. And from the 20 to the 79-year-old bracket, those 7 brackets is pretty evenly distributed. There's about 14, 15 cases per area, and which means for the public that this isn't a virus that's particularly attracted to a particular age group, maybe an older person. That's not the phenomenon. What we're seeing, it's anybody can get the COVID virus. In fact, in the age group of 0 to 19, we have 2 persons that have tested positive for it. And then we have 1 person in the 80 to 89 bracket and 0 in the 90+ bracket. And then just an update on our testing and the labs. This is not the test taken, the sample they take or the specimen, but rather this is the testing of the specimen in a specialized laboratory with specialized personnel, microbiologists for us. We've surpassed the 1,000 mark now, so we're at 1,049 total tests conducted. That includes 415 in our labs and then 634 in the private labs. We're getting information from the private labs like LabCorp and Quest Diagnostics, from the hospitals who submit the paperwork. It's still somewhat tough for us to get it directly from the lab. So the hospitals are reporting about 634 cases that they've referred to commercial labs for testing. And tomorrow we expect that we'll get some significant numbers from the hospitals. So today it's zero. They didn't confirm any new tests taken, but we know probably some have been tested. And with the Easter weekend, their information has been slow coming in. So tomorrow we'll probably see a pretty big spike in the number of commercial or private tests taken. So our number should be larger. I have some information on, in total, where are the persons that have been tested positive. So for that 79, the new total for today, 67 are within the city of Corpus Christi, 1 from Robstown, 6 from Port Aransas, and then 5 from rural Nueces County. So they don't live in any particular city, but rather just kind of in the unincorporated portions of Nueces County. And then what I'm going to tell you now is new information. We talked to the community last week about getting this and beginning to report on it more frequently, and that is who has recovered and what does that number look like. And so I'm going to give it to you in 2 different ways, a big picture way and then who's in the hospital way. So we know we have 79 confirmed cases, persons that have COVID-19. Of those 79, 8 have been fully recovered. So that means they've gone through the battery of tests that's needed to have gone through to confirm that they're negative after they were positive at one point. So 8 of the 79 have fully recovered and are good to go back to work, good to go back into the community. We can look at it one other way, which is who's in the hospital, who's been hospitalized. And this is a microcosm or a subset of the bigger picture. But since we started tracking this on March 19th, that being hospitalizations, 17 persons have been hospitalized in our county because of COVID-19, and 13 to date have been released. Okay, so 17 were hospitalized, 13 have been released to date, and that leaves the 4 that we reported yesterday and still true today. 4 are in the hospital, 3 are in critical condition, and 1 is what we call just recovering. So that's a beginning. We'll begin to tell the community this each day as we get information. So 79 confirmed, but 8 persons have fully recovered. So with that, let me pause for a quick Spanish translation, and then I'm going to go on to a couple other things.
Actualmente en el condado de Nueces existen 79 casos confirmados por el coronavirus. Entre estos, 41 son varones y 38 son mujeres. La gran mayoría se encuentran entre el rango de edades de 40 a 49 años. En total, se han llevado a cabo 1,049 tomas de muestras entre laboratorios privados y el laboratorio del Distrito de Salud. La residencia de estas personas infectadas con el coronavirus son 67 quienes viven en la ciudad de Corpus Christi, 1 persona que vive en Robstown, 6 viven en Port Aransas y 5 en áreas no incorporadas del condado de Nueces. 8 de los 79 se han recuperado por completo, 17 de ellos han sido hospitalizados, 13 han sido dados de alta, 4 continúan en el hospital y 3 en condición crítica.
Okay, thank you. Okay, we're going to go back to the weekend. We know it was Easter weekend, and over the weekend, the city and Nueces County implemented temporary, it was just for Friday, Saturday, and Sunday, closures of both city and county parks and beaches, both our bay beaches and our Gulf beaches. And it was to discourage social gathering, right? We still have to be mindful of staying at home, and really that's the best place for us to be. But if we do get out, stay 6 to 10 to 12 feet away from that next person. And I wanted to take this opportunity to extend a sincere thank you to our residents and community in that they listened to the closures. Our parks were empty, as well as our beaches. We have some footage here that is really probably the first ever for our community, because people love our beaches and they're always packed with cars and tourists and our own personnel just walking the beach. So There's several shots of footage that we had taken actually by Texas A&M Corpus Christi with their drone footage. This is a great one, Mustang Island. Look at that, not a person on the beach. That was taken Sunday, and it was beautiful, extremely hot yesterday too. It would have been great to have gone into the water. Here's another one, Whitecap. This place is usually overcrowded. That's yesterday with 90-degree temperatures, not a person on the beach, not a car on the beach. So we want to say thank you to the community. This is exactly what we need. We did our part to stay apart, and in the end, that's going to help us get over this quicker. The spread, as I'll talk to you in a moment, if we keep this social distancing and stay at home, we can see that the spread will diminish and we can get back to somewhat of normalcy. But we have to continue to do our part, stay apart, and follow the orders that have been given to us by the president, by the governor, by the county judge, Barbara Canales, and by Mayor McComb. It's really for our health, our community's health, and it's to save lives. So just say a great shout out to the community to say that we did it, Corpus Christi, and we got a little bit more ways to go, but thank you for doing what you did, and I think we'll be all the better for it.
Durante el fin de semana de Pascua, las autoridades realizamos el cierre temporal de parques y playas para desanimar a los residentes en reunirse en grandes grupos. Quiero agradecerle a los residentes al haber cumplido con las órdenes. Con estas órdenes temporales esperamos prevenir el contagio del virus. El día de hoy los parques y las playas han reabierto para que los residentes puedan acudir, pero le pedimos que continúe practicando el distanciamiento social y no se estacione a menos de 100 pies de distancia entre cada vehículo.
Okay, great. Now, I just want to give a quick update on our LIFT Fund Small Business Recovery Program. So about a week ago, last Tuesday, City Council approved an agreement with LIFT Fund, Inc. It's a micro-lending organization that the city has had a relationship with for 15 years. They help give loans to small businesses in the normal times, and they have over 100 employees in over 10 states is where they operate. Last Tuesday, City Council approved a $1.7 million loan program for small businesses. Those are businesses that have gross revenues of less than $1.5 million annually. And the loans are great for this, especially for this time, in that there's no payment for 4 months after the loan's approved, and there's zero interest. And so this will help a business stay afloat and keep payroll or pay for insurance or pay for some of that overhead while business may be reduced or closed down altogether because of the stay-at-home orders. The program was approved, as I said. LIFT Fund, that has a local office here, has staff that's working Monday through Friday, taking calls and beginning to process loans and move those forward. We had since last week, or LIFT has had, since we made this announcement last week, over 360 phone calls from small businesses. So our word's getting out. We need to keep talking about it because there's a lot of small businesses. And the $1.7 million we think may go fast, but we're looking for additional funds to keep that loan program going should there be a great demand for more funding. And so 360 phone calls. LIFT has received 66 applications to date, and the application period really started Monday. So 66 applications already, and 4 of those applications are close to being finalized. So that means 4 local small businesses will soon have funds to keep their operations going with 0% interest and no payment for the first 4 months. The council also agreed when they approved this last week that the LIFT Fund staff should focus on businesses that are most impacted by the stay-at-home orders and that were closed pretty much indirectly by the governor's orders. So that means restaurants, hair salons, catering offices, roofing and tire shops. So those businesses are the ones that will have preferential review when these applications come in. Applications were kind of open in a soft way on Friday, but they're live now today. As of this morning, on the screen, you can see where to apply. It's at a website. It's all website-based in terms of the application, but it's www.liftfund.com. Right here, liftfund.com. And then call takers, or professionals, I should say, at Live Fun in Corpus Christi are ready to take your call Monday through Friday, 8:30 to 5:30. Their number is also on the screen. It's 888-215-2373. And so this is for small businesses in Corpus Christi only, and $1.7 million is available for businesses determined to be small if their annual gross revenues are $1.5 million or less. And this is a great opportunity, so call that number, go online and look, and help spread the word. We know local businesses, small local businesses are impacted, and we want to keep those businesses going through these times so that when we're back to normal, they'll be back to normal as well.
El martes pasado, el Concilio aprobó un acuerdo para ayudar a los pequeños negocios mediante un programa de préstamos. Al momento se han recibido 360 llamadas, 66 solicitudes se han llenado y la meta del programa es que se estima de entre 60 a 80 negocios obtengan asistencia financiera. 4 de esos negocios están cercanos a recibir el préstamo. Los préstamos son de hasta $25,000 cada uno y el primer pago se realiza después del cuarto mes. Los préstamos tienen una tasa de interés del 0%. Para más información puede llamar al 1-888-215-2373 o ir a su página www.liftfund.com.
Okay, great. And then my final part before Annette, our Public Health Director, comes up is just an update on the Texas A&M Corpus Christi project. And so we know that the community wants to and has the right to and should be hearing from scientists and professionals, professors, to help us understand the virus and help us with advice on how to progress forward as a community and as a people. We're also thankful for people like Annette, our health director, a professional in the field with over 20 years of experience in the business. We're here to bring you information so you can better understand the virus and how to keep yourself safe, your family safe, and how we can get past this. So last Friday, Texas A&M Corpus Christi brought forth trained and expertised scientists and professors to provide their first assessment of COVID-19 for our 12-county region, and in particular so we can understand the curve. We all know what the curve is from a national level if we watch national TV. We want to know when the spike in cases hits, and we want to know when we're beginning to recover, right? So we've seen it globally, we've seen it for the nation, but we didn't have one here for our region. And so after we asked Dr. Miller, the president of Corpus Christi A&M, without hesitation, she said, absolutely, I'll put some of my best people on that project. And last Friday, Dr. Philippe Tissot and Dr. Chris Bird presented the model that showed us the predicted number of cases in the coastal bend and how the caseload will impact our hospitals and equipment in our hospitals like respirators. And they also showed how we as a community, by doing some of the stay-at-home and the social distancing, how it's making a big difference. And so that was proven by science and facts and modeling. Those professors worked almost a week straight, pretty much around the clock, to get it to us as soon as they could. And so we told the community last week, and I'm saying again today, that was one of what we want to be many presentations. We want the scientists here, we want the professors and those professionals here. And so they will be coming in. Our plan right now is to have them come in every Friday and provide either updates in the model or provide new information as they reach out to the global scientific community. And we'll be having that information right here for our community, which is we're real fortunate to be in that position. Now, last Friday, if you watched the briefing, it's a pretty long briefing for something that complicated, about 25, 30 minutes, I think. But Dr. Bird actually went back over the weekend and without his face mask in his home setting, did the presentation over again and recorded it a little bit differently so that you could see the slides mostly and the graphs, and they're animated, so various things come into one slide so you can better understand what's going on. And he's in a little call-out box in the slide, so the main focus is the material. And that is on our website now, so the city and the county have a joint website. If you go to either of our home pages, you'll see the link for the COVID-19 webpage, and then you'll see a link there for this new video, which is the same information he presented here, but in a little more relaxed environment without a face mask. And people can probably better understand it and also see the visuals a little bit better. So that's available online. We encourage the community to watch that again or watch it for the first time. It has some really good information, one, on how to behave in this time, but two, it really demonstrates and shows you why what we're doing matters. And it shows that without what we're doing, we would be in some serious trouble, as according to the scientists and their predictive modeling. And so this Friday, they'll be back again, as I mentioned, to give an update already with the 3 days since Friday. So we had, since Thursday, really, Friday, Saturday, Sunday, the models have updated a little bit. And so some of the predictions are getting a little bit better for us, and some of the spread rate analysis is getting a little bit better. They'll continue to refine that this week and then come back and report to the community this Friday at 5 o'clock in our daily press briefing. And so I did just want to give a shout out to Dr. Miller and all of the team really at Texas A&M Corpus Christi. I really do know and believe more than ever that we're fortunate to have such highly educated and experienced professors, scientists, and researchers here in our community. They are providing modeling that we see globally and nationally, and we're getting it right here in our city, and we're really fortunate for that. And not only have they stepped up in doing this, but you may have seen in other media outlets, they're also doing other things for the community. They've donated to us testing kits for our labs. They could have given that to anybody, but they gave it to the city. And also, they're on their campus making, right here in town, making plastic face shields for first responders and medical professionals. And so that's just several examples. The drone footage from the weekend. I mean, it's just all evidence that Texas A&M Corpus Christi is really stepping up to the plate, and we're so thankful for Dr. Miller and her entire team for being a great partner with the city and county. That concludes my remarks. We're going to turn it over now to Annette, who will talk about some of the health stuff to include our drive-through testing sites.
El viernes pasado, la Universidad Texas A&M presentó un modelo de pronóstico sobre los casos en el área de la costa para determinar el impacto en los hospitales por el tratamiento de personas con el virus, por lo que es importante seguir el distanciamiento social. En la presentación se demostró que el distanciamiento social da buenos resultados. Si no pudo ver la presentación, esta se encuentra en el sitio de la ciudad, así como en la página de Facebook. El sitio de la ciudad está en la dirección www.cctexas.com/coronavirus. Queremos agradecer a la universidad todo su apoyo con esta información.
Thank you. Today's drive-through went very well with 18 specimens collected. The next drive-through is scheduled for this coming Thursday, April the 16th at 8 a.m. at the same location. If you are experiencing signs and symptoms of COVID-19 and have been exposed to a confirmed positive case and are feeling ill, please contact our hotline at 361-826-7200. As the city manager mentioned, I do too want to thank everyone for doing your part in practicing social distancing during the Easter holiday weekend. We recognize this was challenging for many of us because we had to change many of our family traditions. But social distancing has proven to be an effective mitigating tool to decrease the numbers of COVID-19 cases. We encourage you to continue to do your due diligence. Continue to stay home as much as possible, only going out to do essential tasks, and when you do go out, stay at least 6 feet away from others or wear a mask. Continue to keep practicing good hygiene, such as washing your hands for at least 20 seconds, as often as possible. If washing your hands is not an option at that time, use hand sanitizers. Sneeze and cough into a tissue. Avoid touching your eyes, nose, and mouth with unwashed hands. And as always, if you are sick, stay at home and isolate yourself from our most vulnerable populations. Our goal continues to be to strive to save as many lives as possible here in Nueces County. Thank you.
El día de hoy se llevó a cabo otra toma de muestras para la detección del coronavirus. Fueron 18 las muestras tomadas. El próximo día de toma de muestras será el jueves 16 de abril. Si experimenta síntomas del COVID-19 y ha estado expuesto a un caso positivo y se siente enfermo, comuníquese a la línea directa al 361-826-7200. Gracias a los residentes por hacer su parte en la práctica del distanciamiento social durante el fin de semana por Pascua. El distanciamiento social ha demostrado ser una herramienta eficaz para disminuir el número de casos por el virus. Continúe en casa tanto como sea posible. Solo salga a hacer las tareas esenciales y cuando salga, manténgase a 6 pies de distancia de los demás o use un cubrebocas. Siga practicando una buena higiene, como lavarse las manos con la mayor frecuencia posible, al menos por 20 segundos. Si en ese momento no es una opción lavarse las manos, use desinfectante para las manos. Nuestro objetivo sigue siendo salvar tantas vidas como sea posible aquí en el Condado de Nueces.
Okay, great. So that concludes our prepared remarks for today's press briefing, and we can answer any questions that you might have.
I just have two. One, we're still getting phone calls about golfers still being out there.
Yes.
What can you tell these people?
Yeah, so the county judge for Nueces County has put an order in place that impacts private golf courses, and she has put an order in that prohibits golfing. The city, under Mayor McComb, the city has 2 courses that are managed by a third-party operator, but following the governor's orders, which aren't that clear, has deemed that those should remain, or can remain open, because there's restaurants on the campus of the golf course. Also, the golf course operators have put a lot of social distancing practices in place, and our city attorney has reviewed the governor's written and verbal statements. The issue is that the written statements tell us one thing, the verbal is something different. What we follow has to be the written order. There was some additional clarification put out over the weekend that seems to support the decisions of the mayor and the city attorney, which is that as long as there's ancillary operations on the facility, like restaurants that can be open for takeout, the golf courses also provide a recreation, an outdoor place to exercise. So for those reasons, the mayor at this point still hasn't made a order to close these 2 city courses, but the county has for the private courses.
Okay, just one last question for Annette. I don't know if you can answer this, but we've been getting also a lot of phone calls about mosquitoes and coronavirus. Is that something that you can answer?
What I will say is that there hasn't been any association with mosquitoes to COVID-19 as a carrier, and so at this time, we don't have that association between the 2.
Is that something that you guys are looking at, or studied, or
I have not seen any studies on COVID-19 being a vector of, mosquitoes being a vector of COVID-19. So if there were any studies out there, I'm sure I would have already have seen them. So at this time, no.
Okay.
Hi, so understandably, we understand that there is a guideline for testing, but the CDC has given guidance for COVID-19 that it can be adapted for state and local health departments, given that, things happen rapidly. So given that, are we adapting our guidelines locally, given that the CDC does allow for that? Or are we still only testing individuals that have symptoms and have also traveled?
So early on, it was if they had symptoms and if they had traveled to China specifically, and the CDC guidelines changed very quickly after that. We have adopted the CDC guidelines. We have a federally funded LRN, a laboratory response network, and so we follow the CDC guidelines, which don't only talk about travel. They also talk about if you have symptoms and you're exposed to somebody that's positive COVID-19.
Coming up on Texas Parks and Wildlife. Coming up on Texas Parks and Wildlife.
America has had a really long history of fine arts and environmental conservation.
This boardwalk overlooks
Where we had those very specific guidelines, or when did this change?
It hasn't changed. Normally what happens in the past with different diseases is that the commercial labs come online first, and then public health labs augment the commercial labs. This time with this pandemic, it was different. It was CDC started all the testing, if you recall, initially, and then from CDC, they went to their state health department, so the Department of State Health Services in Austin, Texas, and then they spread out to the local response networks, which there are 10 of in Texas, and we have one locally at the health district. So those didn't change, but what happened was the commercial labs, they got what's called an EUA, an emergency use authorization to be able to test very quickly and to come up with their own test kits so that they could also make money and they could also test people. And so they have two means of testing by the commercial labs. When the public health labs, we only have the one means.
So say somebody, seeks physician assistance and the physician believes that, okay, this person may have COVID-19, and they contact the health district and, they believe that their patient may need to get tested. What happens then?
If they meet the criteria, then we schedule them for the drive-through and we put them through and we test them.
Okay. And if not, then they're required to go and get their own test at that point.
Then the physician could actually order it through a commercial lab, exactly.
Okay. I guess the next question I have is, given the numbers that we're testing, for instance, it was yesterday, I believe it was 4, and then today it was 18, and then we have the modeling that we have. How are we accurately looking at modeling and community spread based on the numbers of people that we're testing?
Well, that's a great question. So the testing depends on the people that actually need the test, So like you said, you could even have people with the commercial labs that don't have symptoms that are still being tested. I think what you're seeing are more and more physicians that are actually testing those individuals that seem like they're symptomatic. They believe them to have the COVID-19 test. So while we're seeing smaller numbers, that's probably a good sign that's saying that less people are sick and that public health hopefully is doing their part by doing the contact tracing and making sure that every person, that index person, the person that's positive, that they've come in contact to, that they know that they've come in contact with that individual and that they're isolating themselves. Because if they isolate themselves for the 14 days, then they have no ability to spread it to others. So while we still see person-to-person or community transmission, the real goal is for us to contain, if you will, that population that could potentially be the spreaders and to keep the spread of COVID-19 in our community.
Okay. Is there still a plan in place? For instance, the Houston mayor just said anyone can get tested. Is there a plan in place to expand testing, to ask for more testing supplies? To really get an idea of, what we're dealing with locally.
Absolutely. I try to remind people that when we have like a hurricane hits like Corpus Christi, that's one particular place. With this one, this is a pandemic that hit the whole world. And so everybody is looking for the same test kits. So that was an issue. Now we're seeing more and more coming in. We're seeing more commercial labs that actually have more test kits available. We're also looking at antibody testing that we're hearing is going to be available either towards the end of this week or early next week. The more tests that we can perform, the more we can actually find out what we actually do have in our population. How many people are positive but asymptomatic? How many people are spreaders? How many people don't have COVID-19? So those are important factors for public health and for us to know as a community. So yes, the more tests out there, the better we all are.
And then the numbers that you have, are we removing the numbers of individuals that are recovered from our total number at this point?
From the number? No. No, they're part of.
So why are they remaining in the total number?
Just so we can have a cumulative. So 79, and then of those 79, we have 8 that have recovered. So we're not saying 71 we don't want to confuse everybody, so we're saying now it's a total of 79 positives. And so 8 of those are recovered.
Okay. And then obviously we're still in the early stages of the potential of using Memorial Hospital, but has that hospital been maintained to JCAHO standards? And if not, what would be the cost and manpower to get it accredited?
That's a great question, but I would not know that answer.
So County Judge Barbara Canales is the lead on that. The county manages the hospital district. So to put a COVID unit in the hospital would need state approval and licensing approval, and all that would have to be reviewed. So it's not a matter of just changing out a few things and then saying, okay, we're ready to go. So there has to be an action plan developed to show that the facility would meet guidelines that are required. That would be submitted to the state, and it would be reviewed by a state agency, who then would tell us, go ahead with that plan or change to meet some of their analysis or specifications. So that's still some time out. Judge Canales will be here tomorrow, her and Mayor McComb on Tuesdays and Thursdays, and she can elaborate a little bit more tomorrow. We know last week the Hospital District Board of Directors held a meeting to take action to say, let's move forward with putting together a proposal that can be submitted to the state and how we can make the second floor of the former Memorial Hospital a dedicated COVID wing. And so we'll have Judge Canales provide more information on that tomorrow.
Okay. You know, the governor has talked about reopening the state. And given what we saw with the modeling predictions from TAMUCC, is there a concern that it could be too soon? Is it a concern that perhaps we should be doing the opposite and putting more stricter enforcement in place, updated orders? Is the city or the county considering anything like that based on the modeling that TAMUCC provided?
Yeah, well, I think the best answer is we're taking this one day at a time. Every 24 hours, or actually every hour, more information is provided to a local community like ours on how to make decisions and how to go forward. We know that we're under the governor's order through the end of April. And so we're continuing to focus on that day by day. The work we did this weekend to keep our beaches and parks empty worked. And so we're taking it day by day. And we'll watch, we'll get updated projections from Texas A&M scientists, Texas A&M Corpus Christi scientists this Friday. We'll see what that looks like. We know everybody wants to get back to what used to be normal living. We know that, as does the mayor and council and the county commissioners and County Judge Barbara Canales, but we're going day by day, hour by hour, and our goal is to save lives, not to jump ahead too far. Save lives, keep people healthy, and get our economy back up and running again in the smart way. We don't want to jump and get back to some type of normalcy too soon and then revert back to something even worse than what we had a couple of weeks ago.
A decision was supposed to be made today regarding Bob Hall Pier and whether it would be reopened. What was that decision?
You know what? I don't think we got an update from the judge, but it was supposed to be, the orders that we put in place were to, for the beaches, including Bob Hall Pier, Bob Hall Pier to be closed just till 6 a.m. this morning. So it should have opened up unless there's something. Did you hear something?
Yeah, it was with the exception of Bob Hall Pier.
Okay.
Yeah, so, okay. So we should ask tomorrow about Bob Hall Pier.
We can give you an
Okay.
update tomorrow.
Okay. This should be my last question. All along it's been said that the focus is education and making sure people are educated about the orders in place. However, we do know that some citations have been issued. Do you have a total for the number of citations that have been issued, or can you get us a total?
We can get you a total. I don't have that today. I know the police department's number one job is themselves is to educate. It's not to punish. It's friendly reminders and just making sure people follow the rules to protect them and save lives. So we'll get you a number tomorrow. Yes. Okay? Okay, great. Well, thank you for tuning in today. Tomorrow we'll be here again at 5 o'clock. And consistent with our Tuesday, Thursday plan, Judge Canales from the county will be here, and Mayor Joe McComb from the city, as well as our Director of Health, myself. And we'll keep you posted on our medical director, Dr. Ramachandruni. He may be here tomorrow. If not, either Wednesday or Thursday. We'll keep you posted. Thank you.